Hi, good afternoon. My name is Michael Alonso, and I am a graduate student here at Florida International University, and I'll be covering HIV and AIDS in the Dominican Republic. So, the Dominican Republic is located in the Caribbean. It's in the Caribbean Sea, actually, and it borders Haiti and the island of Hispaniola. It actually takes up two-thirds of the island of Hispaniola. It has a total estimated population of 10.8 million people who pretty much all speak Spanish. That's the official language, and it has a racial ethnic background. And again, this is self-reported data in a country that has a lot of ingrained, social issues surrounding racism and issues like that. And so what is reported is that 70.4% of those individuals are mixed, meaning that they have a Taino or Mestizo or mulatto background. 15.4% of those individuals identify as black, and 13.5% of those individuals identify as white. The majority of the population, 39.66% of them, are in the age range of 25 to 54 years, and sprinkled in the years after that. So 55 to about 65 years and over is a very small percentage of about 7%, and individuals that are younger than 25 years of age comprise about 40% of the population. I think it's important to identify what the economics of the Dominican Republic are, seeing that HIV is a disease of the poor. As we've said for over 30 years, it tends to affect disproportionately people who have a lower socioeconomic status or live below the poverty line, not just in the United States, but obviously globally. And so in 2016, the GDP, the gross domestic product of the Dominican Republic, was $176.2 billion, which might seem like a lot, but when compared to the United States, our estimated GDP was about $18.57 trillion. So there's a huge disparity there. Per capita, it's about $17,000 of the GDP, and in the United States, it's actually $54,466. And that's a per capita GDP. That means that 30% of the population in the Dominican Republic live below the poverty line. In the United States, it's only about 12%. Now, let's get into the HIV epidemic in the Dominican Republic. In 2016, there were 2,500 new infections, and that raised the number of people living with HIV to 67,000. Now, what does that look like in terms of gender? Well, for women, and unfortunately, they do not track transgender individuals. They couple them with men, since they were biologically born as men, or women if they were biologically born as females. And so by gender, women comprise 33,000 cases, and men comprise 32,000 cases. So it's a ratio of about 1:1. And children account for the rest of the cases, which is 1,700. The main mode of transmission in the Dominican Republic is heterosexual sex. And something I think is important to note is that there are a large number of individuals who have tuberculosis in the Dominican Republic as a whole. But when you combine that with HIV, we do know that tuberculosis is a opportunistic infection, and it can be fatal if you're, co-managing HIV and AIDS. And so I wanted to talk a little bit about TB because I think it has a lot to do with the rates of AIDS and the rates of morbidity in the country. And so 25% of individuals that are HIV positive are also being co-managed for tuberculosis. And in fact, 21% of newly diagnosed HIV individuals also have an active TB infection. Luckily, only 1% of those individuals that are identified are not in treatment. And there were less than 500 deaths associated with tuberculosis in those individuals that were HIV positive. Now, for AIDS, there were 2,200 AIDS-related deaths in 2016. The UNAIDS has this model of 90-90-90, right? So 90% of individuals who are positive know their status, 90% of individuals who are living with HIV are in treatment, and 90% of those people that are in treatment are virally suppressed. It's a continuum. Typically, it's been a cascade, and much like in all of our countries, including the U.S., we actually have a cascade in this situation. And so 69%, it's estimated that 69% of the individuals in the Dominican Republic that are HIV positive know their status. 46% of those individuals are actually in treatment, and 28% of those individuals are virally suppressed, which is still a really good number. and we have a lot of work to do. We know that viral suppression is key. It's important in not only, reducing the community viral load, which reduces transmission, but also for health-related outcomes. I wanted to talk a little bit about key populations. So what are some of these individuals that are disproportionately affected, underrepresented, marginalized, etc.? And I've broken this down into different groups. We have sex workers, transgender individuals, men who have sex with men, people who inject drugs, individuals who suffer from intimate partner violence, and I also wanted to talk a little bit about PrEP, or pre-exposure prophylaxis. So for sex workers, we see that 3.7% of them are living with HIV, and 85% of them self-report using condoms. For transgender individuals, it's estimated that they make up about 8,891 people. Again, this is self-report data, and luckily, though, we do see that with our HIV prevention programs, they are accessing about 33.75% of those HIV prevention programs. So it is getting to them in the community, and I'll talk a little bit more about that later. For the men who have sex with men category, this is actually, it's in the Dominican Republic, it's just reported as gay or homosexual. It's very difficult to get men who don't identify as gay to identify as having sex with men, and we'll talk a little bit more about that as well. But there's estimated 124,472 individuals are self-reporting as gay, and 7.1% of those individuals are living with HIV. 39.5% of those individuals are reporting using condoms. And something that I think is poignant to mention is that there was a 12.9% syphilis infection rate in this population in 2016. And that's very important because, as we know, being co-infected with an STI, or not being co-infected, but just having an STI infection greatly increases your risk of getting HIV, or one's risk of getting HIV. And so it's important to note that, we're only talking about HIV and AIDS, but it doesn't exist in a vacuum. We want to look at these other morbidities as well. For people who inject drugs, I don't know if this number is accurate. It says only 900 of the 10 million people are injection drug users. But again, this is a self-report data, and there's a lot of stigma around, injection drug use. But when we do interview them, we see that 45.4% of them are reporting using condoms, and 70.8% of them report safe injecting practices, which is great. They're actually receiving, on average, about 2.1 needles that are being distributed to those individuals. So that's good. With intimate partner violence, these implications for me as a social scientist, but also as a public health professional, when I think of, and in the Dominican Republic, it's 15.6% of women are reporting being a victim or a survivor of intimate partner violence. And these implications indicate that there's probably not great condom negotiation going on, given that they're in an intimate partner violence situation. And as much as I looked, I found no data on PrEP use, which I'm not surprised given the fact that they're still working their treatment cascades and their treatment continuums and making sure that they have a universal response or a central response to HIV. And I'm sure once that infrastructure is there, they will move on into pre-exposure prophylaxis. Women, again, are near and dear to this epidemic in this country and across the world. And so I want to talk a little bit about perinatal prevention as well. In the Dominican Republic, as of 2016, according to UNAIDS, 83% of pregnant women who needed ARVs were getting it. And in 2016, it's estimated that 910 women were receiving antiretroviral treatment while they were pregnant. And the women who needed it in total was 1,100. So that's 83% is 910. And when it comes to early diagnosis in infants, it's only 58%, and I know only is a judgment, but we're seeing that the transmission averted is less than 200. Preferably it should be 0, and so obviously there's work to be done here about perinatal prevention. For young people, only 45% of children who are HIV positive are actually in treatment. And when they did the surveys, they found that 42.8% of young people actually have knowledge of HIV prevention. So there's work to be done, but almost half of them are knowledgeable about HIV and prevention, and that's really, really good. When they looked at condom use, at the last high risk sexual encounter, what UNAIDS found was that 71% of males report using condoms, and 44% of females report using condoms in their last high risk sexual encounter. Now, I wanted to talk a little bit about social cultural implications. Again, this is not a virus that's just medical. We know that this is a virus that affects, socioeconomics, or it's affected by socioeconomic status, literacy, health literacy levels, poverty. And so in the research, one of the things that stood out for me were what are some of these interactions that are leading to, or that have implications in the HIV/AIDS epidemic. And specifically, they're looking at an area called Boca Chica. And Boca Chica is very well known for tourism. The beaches are beautiful. There's a lot of opportunities for tourism to thrive, including sex tourism. And so when there is a high traffic tourist area, that tends to create a differential in economic status in these countries, in these developing countries. And so one of the implications or social cultural implications around HIV in this particular area when they were doing the study was they saw that poverty, and I mean obviously this is not new, but lack of access to services and the stigma associated with receiving those services has an impact in the way in which people talk about HIV or even get tested for HIV or seek services. Another one is malnutrition. One requires having good nutrition in order to appropriately digest and be on a successful ARV treatment and digest those medications. And some of these individuals don't have access to food, and they say, why would I get on medication if I can't properly, nourish myself in order to, be part of this treatment. And it's an adherence issue at that point. Another social cultural implication was neighborhood cohesion. So there's a lack of neighborhood centers, places where people can go to get information, and what that does is that it leads to more violence. There's less cohesion in the neighborhood. There's less interactions in the neighborhood. People perceive violence as an external factor that's affecting their area and actually don't realize, or not that they don't realize, but there's no sort of understanding that high neighborhood cohesion and having these access to these services and these centers can actually, drive out violence in these areas. And so folks report having, are feeling less safe in their neighborhoods. And of course, if you feel less safe, you don't want to interact with your neighbors because you don't know who you can trust. There's also a gender-based inequality. And again, this is not new. It's a little startling for me having been doing HIV/AIDS work for a while to see how, gender inequality plays a role, not just in what's in the mass media, with let's say pay gaps, but also in public health. And in the Dominican Republic, HIV/AIDS is the leading cause of death in women of reproductive age. And women tend to experience more discrimination in the workplace and also in healthcare settings, meaning physicians or nurses or any medical personnel will discriminate women in a healthcare setting more than they would others. And something that also is disturbing but happens is that women's statuses will get disclosed without their consent to their communities. And what is causing or what are some factors that are contributing to this HIV/AIDS epidemic is not different from what's going on globally, right? So the MSM population is a contributing factor, especially because there's a lot of sex work happening in men who have sex with men who are more vulnerable to HIV infection because some of the Johns or some of the individuals who are paying for sex work, especially if they are tourists and they're involved in sex tourism, are willing to pay sometimes 3 times the rate in order to have condomless sex. And that puts men in a very vulnerable situation. And not only that, but also, because of the stigma associated with homosexual acts, but also it prevents them or deters them from wanting to get tested And so they might be, acutely infected, or they might have seroconverted, but they don't know their status, and they're not in treatment because of the stigma associated with that. And since I mentioned sex work, again, it's very difficult to get accurate data of sex work, but it's estimated that about 100,000 women are involved in sex work. And, according to the previous statistic, we say about 85% of them are using condoms. But again, when it comes to being able to pay for play and be, putting women in vulnerable situations. And then another contributing factor is substance use, but specifically the increase in substance use, right? And so seeing how now the Dominican Republic is becoming, and Haiti as well, because it is one island that is split, but the South American cartels are using the Dominican Republic to traffic cocaine and marijuana, and also, launder money. And we're also seeing an increase in trafficking of ecstasy from the Netherlands. So these are all contributing factors to the HIV epidemic in the Dominican Republic. And then another contributing factor is stigma. You can't talk about HIV without talking about stigma, because it really is sort of the thing that if we were to overcome would make a significant difference, right, in the incidence of HIV nationwide and globally. And they did a survey where they asked individuals if they were willing to buy fruits or vegetables from a person who was HIV positive, right? So are you willing to buy these goods from a person with HIV positive? The Dominican Republic, 49% of individuals said no, they're not willing to do it. So almost half the population is carrying some sort of stigma and discrimination towards these individuals that are HIV positive, or the epidemic in general. And of course, modes of transmission, etc. But there are some key players. It's not like nothing's being done. There is COPRESIDA, COIN, CESPAS, ASA, which stands for Amigos Siempre Amigos, TRANSA, which stands for Trans Siempre Amigas, CEPROSH, and the list goes on. And these are, the Presidential Commission on AIDS, and these alliances of individuals or groups or networks of individuals who are targeting HIV prevention and trying to, get treatment to individuals based on different social networks, right? So trans, sex work. I know COIN does work of linking sex workers to alternative lifestyle programs, so giving them skills to be able to get into the labor force so that they don't have to engage in sex work. I don't want to, I think it's important to mention that the Dominican Republic has made some great successes given its limited resources. The HIV incidence in 2005, so about 10 years ago, because the last data was 2016, the HIV incidence was 3,900, so 3,900 cases. And 10 years later, it's almost half. It's 2,500. I'm sorry, it's not half. It's a reduction of almost 1,500. So it's 1,400 cases reduced in 10 years. Same thing, AIDS-related deaths in 2005 was 7,400. And in 2016, it was only 2,200. So we see a huge drop there. And there have been some good policies, some laws that have been generated from this epidemic, and one of them is there are protections from discrimination in employment settings. Now, much like the early epidemic here in the United States, even though those laws were in place, people still often discriminate, but at least the laws are in place, and they can be challenged if necessary, or decisions can be challenged if necessary, and also some great policies. So the 100% condom use policy or program, which is similar to Thailand's program. There are some challenges. There are some criminalization laws around HIV. Of course, there's still stigma, which prevents testing and increases violence. And then, of course, sex tourism, which is, there's just not an ability to access data. People are willing to pay more for condomless sex, and the lack of self-report. So I wanted to thank you for taking the time to listen to my presentation about HIV/AIDS in the Dominican Republic. I have attached references, and there are more to come. Those references lead to more. But I do want to, again, thank you for your time, and hopefully you learned a little bit about HIV and AIDS in the Dominican Republic and what, impacts